the 1st, which is tomorrow, sexual health is an integral part. Good evening. Good evening, everyone, and welcome to our first ever Clicks Wellness Expert Panel webinar. My name is Tarryn K. Trussell van Louw, and today we delve into a topic that demands our attention and understanding: safe sex, HIV, and sexually transmitted diseases. Now, in recognition of World AIDS Day, observed annually on December the 1st, which is tomorrow, sexual health is an integral aspect of our overall well-being, and discussing it openly is essential to break down stigmas and misconceptions. Now, we have a wealth of information and advice brought to you by our expert wellness our Clicks Wellness Expert Panel members, Dr. Mpume Zenda and, of course, Dr. Aadil Khan, whom will be joining us shortly. And in today's webinar, we want to empower you with knowledge to make informed decisions about your sexual health. Now, our speakers, this is going to be exciting. Our expert speakers are here to guide us through essential information, offering insights into safe sex practices, the importance of regular testing, and the realities of sexually transmitted diseases. Before we begin, I want to emphasize something very important: the importance of creating a safe, non-judgmental space. It's okay to have questions, to have uncertainties, to have concerns. We're here to address them with sensitivity and with respect. So this is going to be very enlightening, very empowering, very refreshing. And you are here to get all that wealth of knowledge along with me. This webinar is not only an opportunity for us to learn from our experts, but also a platform for you to engage actively with us. So let's engage in a good dialogue to promote awareness, to dispel myths, and to encourage proactive approaches to sexual health. Feel free to ask questions and to share your thoughts during the webinar. And of course, use that hashtag Clicks Wellness Experts, followed by your question, and one of our experts will answer our questions towards the end of the live. So let's meet our experts who will guide us through this critical conversation. Allow me now to welcome them. I would like to welcome our Clicks Wellness Expert members. Please welcome Dr. Mpume Zenda. It is wonderful to have you here this evening. Doc, if you could just unmute yourself.
There we go. That's what happens at webinars. Hello, everybody.
Here we go. Welcome.
Thank you so much. Tarryn, absolutely fantastic. You're amazing. I'm excited about this, and I love the fact that you jumped onto why also we are thinking about World AIDS Day. So this is absolutely exciting, and I am so glad to be here.
Fantastic. I'm so glad that you are here. Thank you. Dr. Zenda, it is obviously very great for you. You can be here. You're more commonly known as Dr. Gynae on the socials. So you can tell me how you wish to be addressed. But thank you so much for being here. And over to our next panel member, Dr. Khan. Are you there?
Good evening, Tarryn and Dr. Zenda. How are you guys?
Fantastic. Welcome.
Thanks for having me this evening, and hi to all the viewers. What a relevant topic with World AIDS Day being tomorrow, and obviously with the pandemic of HIV and AIDS in the world at the moment, I think it's very relevant that we speak about these topics, and I think it just creates a nice, safe platform for us to really learn, educate ourselves, speak about things where traditionally you may be a bit hesitant to walk into your doctor's office and you don't feel comfortable with these topics, you know.
Fantastic. And this is where it starts, by normalizing this kind of conversation. So let's dive into our topic. Sex is fun, it is exciting, and we can easily get wrapped into the heat of the moment. How can we have fun and a safe sexual experience with our partners? Dr. Zenda, let's start the conversation with you.
Yeah, that is so important. You know, we're talking about two aspects that are very important in our sexual intimacy. One is safety, but also the other one is still making sure that we are enjoying ourselves and we're having fun. I always say safety is sexy. It is important for us to create safe environments for our client, for our partner. And how do we do that? One of the things that is most awkward and may feel a little bit embarrassing is being able to talk about your past history as you enter a new relationship. You have to discuss where have you been, what do your test results look like. We often advise and encourage people to do what we call a sexual screen. That is something that you can share with your partner. So it is important religiously or obviously the very can get to a point where you are happy with your partner to say we can go to the next phase of our relationship where you may choose not to use any barrier method like a condom.
Love that. Thank you. Thank you for that, Doctor. Let's talk about sexually transmitted infections. Dr. Khan, can you please explain the difference between STIs and the importance, or the different types rather, of STIs and safe sex in preventing their transmissions?
Yeah, I think just to touch on what Dr. Zenda said also, I mean, taking good care of your sexual health is a very important part of being sexually active. And, it includes practicing safe sex, educating ourselves about sexually transmitted infections, and knowing about contraception if it's necessary, and knowing about regular screening, and as well as how to manage issues if they arise, and also where to get help from. There are about more than 30 different types of bacteria, viruses, and even parasites that are transmitted through sexual contact. I mean, that can be through vaginal, anal, or oral sex. And even some of these STIs can be transmitted from mother to child during pregnancy, childbirth, and even breastfeeding. And, some of these pathogens are incurable. I mean, of the 8 the pathogens that have the greatest incidence of STIs, if you look at the incurable viral infections, those include your HIV or AIDS, your HPV, your hepatitis B, etc. So we speak about safe sex practices and preventing transmission. And I think a lot of interest has grown into the ABC approach. I think we're all familiar with it. A for abstinence, so obviously delaying sexual activity until you're married. B for being faithful and only having one partner. And C for condom use. And obviously, I think we underestimate the use of a condom. When used correctly and used consistently, they offer one of the most effective methods in protection against STIs and HIV or AIDS.
I think condom culture, and please, I'm definitely a layman in this space. You guys are the experts, but normalizing condom culture, having them readily available, taking it out, looking at it, explaining how it works. Because for the longest time, I think it was a little bit of a taboo, because it looks like a certain thing, and why is it so slippery? And so definitely, I think what you're saying is so important, that we have conversations and normalize the importance of something like a condom and why it's so very, very important to be part of your sexual relationship, or your sexual culture, if I could put it that way. Dr. Zenda, what is the distinction between sexually transmitted infections and sexually transmitted diseases?
Right. That is really important. And, language makes a big difference because we live in a culture where stigmatization of things like, sexually transmitted infection can happen. So when we are talking about a sexually transmitted infection, that is, right. So that alludes to the actual virus or bacteria, like Dr. Khan was talking about. It speaks to the bug or the organism that causes the disease. So you may be infected with a virus or a bacteria, but not necessarily show the symptoms thereof. When you're talking about a sexually transmitted disease, it means as a result of those bugs, those infections, then you subsequently get some kind of a pathology. But not only that you get it, you also get symptoms that may, for example, something like gonorrhea and chlamydia will in the interim cause a discharge, maybe irritation. But later on, especially if it's not treated, it can cause an even more sort of like detrimental disease like pelvic inflammatory disease, which basically means the tubes are infected, and that can cause blockage. But the subsequent consequences of that are things like an ectopic pregnancy, are things like infertility, for example. So it does become important what we do in the beginning as we find out that we have contracted a sexually transmitted infection. Even if it's an infection, it still warrants treatment. Only 20% is likely to go untreated and be fine. So you can't take that kind of a chance. And so I encourage, treat yourself and make sure that your partner as well is treated, even if they're not necessarily symptomatic.
Wow, I learned something absolutely magical here. And it's so important that people understand this, because it's almost as if we only respond when we see it on the surface, or we only
Perfect.
start, becoming proactive when it's in its worst stage. So that has been really valuable to understand. Now, with that, Dr. Khan, in relation to the STDs Dr. Zenda has just mentioned, please can you elaborate on common STD symptoms?
In general practice, often we find both males and females will present with a bit of pain and discomfort during urination. Often we get females complaining to us of even pain during sexual activity. I think an unusual discharge from the vagina, the penis, sometimes it can have a very foul odor. Sometimes we see patients with sores or bumps around the genitalia. Some males present with swollen or even painful testicles. So I think those are the most common symptoms that they present with. And then obviously from there, we investigate further whether it's a urinary tract infection, an STI, and whatever it is, and work on obviously a syndromic management around the patient. Often patients would present when, like we touched on, when the disease is very advanced and, they've had symptoms for days on end and then excruciating pain and things, and that's when they actually come to us.
Yeah, it comes back to the point that Dr. Zenda was making, that, being proactive and ahead of it and being aware and somewhat in control the whole process. It's so imperative. Dr. Zenda, what common methods of diagnosing STDs, and what are the common methods of diagnosing STDs, and how crucial is early detection? We're speaking about this matter, and I think it's quite important. In that way, we're understanding our bodies, we're understanding responses. Sometimes when these things, we go into denial and panic, and so I think people that have no idea what is happening and is experiencing things for the first time go into that fight or flight kind of stage of being, and just how do they respond? So could you shed some light on various treatments options available for the different STDs out there, and the effectiveness?
Oh, that is so important, Tarryn, and it is so unfortunate when we're talking about diagnosis. It's so unfortunate that a lot of the times, by the time a patient comes in, very often it's because they really, really are experiencing a lot of discomfort or pain, and some of the the symptoms that Dr. Khan was talking about. When they generally come through, the first thing we want to know is the symptoms themselves. So that, are they having a discharge? Are they having an ulcer? Are they having any irritation, itching, and so forth? Then the next aspect that we generally would look at, depending on the suspected STI, for example. So if it's a lesion, for example, we may take a swab at the base of the lesion and send it to the laboratory and confirm that. If it's a discharge, we may take a swab, send it to the laboratory. Also, things, for example, like HIV, that we have to take a blood test and get that tested. Others, we can look at things like urine and what is really nice when it comes to, sorry, I'm just hearing a bit of a noise. What is really, what we've done when you look at the policy in terms of how we treat, because we often want to treat immediately, and sometimes laboratory information may take a little bit long, particularly when it comes to the bacterial infections, because those are easy to treat just with antibiotics with a minimum of about 7 days. That really goes a long way. And we have a policy of treat as quickly and as soon as possible. When it comes to viral infection, on the other hand, so this is things like herpes, human papillomavirus, HPV, those are a little bit tricky because viruses don't ever leave our bodies. Once you've had it, it kind of stays there, but your body does a great thing in producing what we call antibodies, which help to suppress it, but also help to fight you having recurrent symptoms or recurrent resurging of that of those symptoms. And then when it comes to the treatment, unfortunately, when it comes to viral infections, we don't generally have treatment of the virus itself. We often will treat somebody symptomatically, meaning, for example, herpes. We'll give something like an antiviral to help with the pain and to get the lesion or the sore to kind of die down. So those are generally the methods that we use. But what I often and always encourage is, even if, like I said earlier, even if you do not have symptoms, you spoke about all the taboos and the myths. We all know when you're like, I wasn't as careful the other day when I was sexually intimate. Let me go and be proactive and check. Don't wait until you have symptoms.
Absolutely. And I think that's so important. I think that we spoke about this a little bit earlier. The denial space is always such a touch and go space. So rather be proactive and get onto it. Absolutely. Now, I just want to quickly invite our viewers at home again to please participate and engage with us. Use the hashtag Clicks Wellness Experts. Pose your question. We're going to have our panel answer over here. They are the ones, okay? They're the ones with the wealth of knowledge, and they will be happily participating in answering all those questions that you may have. So please go right ahead. Dr. Khan, from a male's perspective, how does sexual health change with age? And what can individuals do to maintain a healthy sex life as they get older?
I think your sexual response starts to slow down after the age of about 50. Obviously, as a male, we are very testosterone driven, and science suggests that obviously our test levels decrease by 1% per year from the age of 30. I think in practice, I only really see it from 35 onwards, and it's a major contribution to our libido as well. As we age, our bodies also change, including our weight, our skin, and our muscle tone. And I think some older adults don't feel comfortable in their aging bodies, But in my opinion, I think that obviously your sex drive is more likely to be affected by your health and your attitude about sex, and obviously intimacy by your age, But just to reinforce, obviously, sexual health and intimacy is important at any age. We're sexual beings, and that fact does not change even when we cross a certain age threshold.
100%. And then, as you say, it plays a massive mental role as well, the way that we look at ourselves and the way that we love ourselves and respect ourselves. So I hear you 100%. Dr. Zenda, what are your thoughts on that question? How does age impact females and the female sexual health? Are there specific considerations for sexual health during different phases in their lives, or my life, other fellow sisters out there's lives, such as puberty, adulthood, menopause? Menopause is something that it is unspoken of. I think it's only more recent now that we are becoming more open about conversations around that. What's your thoughts on that?
Yeah. Oh, that one. I love that question, Tarryn. And this is because, especially for us as clinicians, it's so important to understand the phases of a woman. As we go from childhood to puberty, there are a lot of changes that are happening in that space. So when it comes to sexual health, introducing your child to a gynae, a healthcare provider,
Yes.
as early as or as soon as possible, especially like around their menstrual health. Very often as well, when we're talking about sexually transmitted infections, giving or offering, recommending vaccines for girls, for example, like HPV vaccine, that becomes really important because it impacts it impacts even and especially when they haven't started being sexually active, what happens later on, you've already kind of prepped their body to kind of face up to what's about to happen in the future. So we generally are talking things like menstrual health, the changes of the body, emotional. You spoke about emotional health. That becomes so important in puberty, because teens are very almost volatile in terms of their mental well-being, and we see things like suicide hikes, especially around the teens. Then you move to what we call the reproductive women. Definitely things change there. Now you're looking at a woman who is likely to be sexually active. You're looking at a woman who is likely to be thinking about the possibility or whether they want to fall pregnant or not fall pregnant. So these are the people who are engaging. I also want to just highlight that it is also totally okay for people not to be thinking about wanting to have children. In fact, in this day and age, we see a lot more women waiting a little bit longer to spend time in their career, to spend time in things like self-development before they start having children. And yet we are still engaging in sexual activity even throughout this time. So things like prevention, things like regular checkups with your doctor for pap smears, for sexual screen, becomes really important. We often, not assume, we know this from research and just scientifically, that the peak of sexual health or sexual pleasure is roughly from about 25 all the way to about 35 years of age. And this becomes important. You spoke about menopause. As we hit about 35 years of age, our estrogen declines, even our testosterone declines. So there's definitely an impact not only on our sexual health, but also when I say sexual health in terms of intimacy and pleasure, but also with that decline of estrogen, what generally happens is women, especially in the perimenopause into the menopausal phase, you find that you are more drier. That means you are also more likely to have little scars or lacerations during intimacy. It's likely to be more painful. And just a flag there that you're also more likely to pick up, sexually transmitted infections, the more vulnerable and fragile the lining of that vagina is. So it is always important. And I never ever want to exclude, I love what Dr. Khan said in terms of, sexual health is important for us at any phase of our lives. What we are seeing as well is, whether it is as a result of, people just being more free to have sexual intimacy well into their 60s, into their 70s. People are engaging more in sexual activity, even as adults. So we are getting a bit of a challenge in terms of, so when, or how far or how long should we continue doing things like pap smear? So I always encourage, as long as you're still sexually active, and particularly if you've had a recent change of a partner, please do make sure that you still continue to do your sexual screens.
You have literally opened the floodgates. There are so many levels to what you have just responded to me that I'm just going to try and just filter through it. Number one, the matter of normalizing visiting a gynae. I think for the longest time, young girls that go and visit gynaes have this big sign over them like, ooh, what are you up to? When actually it is so vital to start normalizing a relationship with the person that is going to be holding your hand during your journey as a woman, through motherhood, through changes, through menopause. So a little bit louder for the people at the back. I absolutely agree with you. If I were to maybe speak from my experience, for the longest time, I understood that gynaes are associated with babies, and that is that. And so many of my peers only started visiting gynaes when they fell pregnant. So those are the kind of, debunking that has to happen as well, that gynaes are there to literally, like an eye doctor, like a heart doctor, this is your sexual reproduction doctor. So we need to normalize that it's fine to go, without being labeled.
Yeah, that is absolutely vital. And the more you get comfortable in that space, one, you also get the opportunity to choose the clinician that you resonate with. And I encourage a lot of women to do that. Do a little bit of research, a little bit of education on yourself, so that you know what are the things to expect when you do go and see your doctor. But I couldn't agree with you more. It is so important. And it is actually, I often say in my practice, I actually don't see a lot of sick people. I see a lot of very well women. You know,
Yeah.
99.9%, it's very well women. And this is because for us, it is important not to wait for things to be wrong, but to annually be able to go and see your healthcare provider and just check that everything is still in place,
Yes.
everything is still okay.
100%.
Ask the questions you want to ask.
Fantastic. Absolutely. Louder, a little bit louder. Thank you, Dr. Gaini. I'm going to proceed now and go, Dr. Khan, let's talk HIV and AIDS. What is the fundamental difference between HIV and AIDS, and how does HIV progress to AIDS?
We'll try and keep this one simple for the viewer. So, HIV is a virus that attacks the immune system and obviously weakens it severely in human beings. And AIDS is a medical condition that occurs as a result of HIV infection. So basically, you can't get AIDS if you're not infected with HIV. So the HIV severely weakens your immune system, and then AIDS is almost referred to as the last stage of HIV infection or the most advanced stage of disease. And it's important to know that not everyone with HIV progresses to AIDS or the advanced stage of disease, but without treatment, almost all living people with HIV will eventually advance to HIV or AIDS. That's why it's so important to get tested, and it's so important to initiate therapy very early in HIV.
Absolutely. I think that's a very important point that you've just made, that this culture of testing, knowing that denialism is almost a safe, comfortable space for many people. So you find that prolonging and just, staying in my little happy bubble of denial often just causes that we speed up the process to eventual AIDS. So yeah, I
Yeah, I
hear
think
you.
many years ago there was a real stigma attached to going and testing for HIV and stuff. But I think people over the years, because they've seen the severity of disease and the number of deaths worldwide and stuff, people have become more comfortable with it. So, I mean, I often get a lot of people that walk into the rooms that are not there for an HIV test, and we offer them maybe a rapid test, which is not 100% accurate, but at least they have some form of knowing this, and this is my status. And I think what I've done also in all my practices is that I've made it routine. If a patient comes with UTIs, STIs, or some sort of differential diagnosis around them, we try to encourage them to get tested for HIV, whether it's a rapid test or even an ELISA, whatever form of test we do. But you need to know your status today.
100%. Dr. Zenda, how crucial is early detection in managing HIV, and what are the available testing options? I know that Dr. Khan made a quick reference to the rapid option, but are there specific signs or symptoms that might indicate potential HIV infection?
Yeah. So definitely, reason it's important for early detection, and Dr. Khan touched on it a lot. What generally happens is the virus attacks your immune system, but we can halt it once we diagnose and start treatment. You then suppress the rapid replication or multiplying of that virus. So the sooner we do that, the more we are likely, or rather, the more unlikely we are to progress into the disease. We know now, if you think back in the 90s, for example, when there was a huge surge of HIV, and it's not that it's not there anymore, it's still there. People are just adhering to medication, getting treated, and are getting diagnosed and getting treated early, which is a great thing. It's also the reason why we're getting what Dr. Khan is talking about. People who have become a little bit more relaxed. I mean, I don't know about you. Do you remember the kind of ads we used to see, and just the campaigns and the drive back in the days? We don't see that as much. And I don't know if it's because now we have antiretroviral treatment available. But having said that, and perhaps I'll always be a little bit more biased to the women. One, we are generally more prone to getting infected compared to men, and that's got to do with the way that our lining of our vagina is designed. But also, secondly, we also very often have desire to be reproductive and wanting to prevent a mother-to-child transmission. So even then, I mean, we have it routinely. As soon as a pregnant woman comes in, one of the things that we test in the first trimester is HIV, so that if we diagnose early, we can start her on treatment, and that will help prevent mother-to-child transmission. So it is very crucial, and it kind of allows us to have what we all talk about, which is, HIV could be just like diabetes. You can live for a very long time without being sick or symptomatic, but it does take a diligence in, like you said, early detection, get diagnosed, get treatment, stay and comply to the treatment.
Absolutely. It becomes lifestyle, I suppose.
Absolutely.
It's a way of living. Absolutely. Now, with that, it's a great segue to going into my next question. What role does awareness play in preventing the spread of HIV, and how can we, our viewers, actively participate in raising awareness? Dr. Khan, can you tell us a little bit more on that?
Yeah, I'm just going to reinforce some of the things that Dr. Vedna said. Obviously, people can only start HIV treatment if they know they're living with the virus. I mean, current statistics from the WHO show that there's still about 9.4 million people worldwide that don't know that they're actually living with HIV. So the earlier you're diagnosed and living with HIV, the earlier there's life-saving intervention. And we as medical professionals, and even our viewers at home, we can really play an active role in raising awareness and making a difference. We can all practice safe sex to prevent the spread of HIV. There's days like tomorrow, the 1st of December, that's World AIDS Day, and it's an international day dedicated to raising awareness of the AIDS pandemic and spreading of the HIV infection, and even mourning those who have passed away from it. So each and every single adult plays an important role in creating awareness so that we can have early detection or early testing and then early life-saving intervention. Because, people now can live a very long life, even with the disease, if it's under control and it's not progressing rapidly.
Absolutely. I think we have made leaps and bounds from where we start with our understanding and all the stigmas and all the labeling to where we are today, where we can comfortably have conversation, safe, comfortable conversation around the matter of HIV and AIDS. Now, for our viewers who are wanting to start a family, how does AIDS, HIV, and other STDs impact pregnancy and fertility? What precautions should individuals take, during this period? Dr. Zenda, can you maybe advise on this?
Yeah, and maybe just to, I think one of the things you specifically asked about in our previous question is, the testing methods. It's great that now we have what we call the rapid test that can be even home, can be done at home. There's rapid tests that can be taken at home or at your doctor's, but for definitive diagnosis, especially when somebody is like, no, I'm not sure, I want something that is more proof, we have to then take a blood test and test not only whether it is negative or positive. As soon as it's positive, what we also want to find out is, what is your viral load? What is your viral count? And also in terms of your immunity, what's your immunity doing? So there is sort of like a direct sort of like opposing between your viral load. The higher your viral load or the amount of disease or virus you have in your system, the lower your immunity is fighting. So what we call the CD4 count, and vice versa. So we are generally encouraging clients to not just get tested whether they are positive or negative, but also to have continuous tests to see where are you in your viral load, because the higher your viral load, you are more likely to transmit, whether it is to your partner or even to, if you are pregnant, to your unborn child. So that becomes really important. Tarryn, can you just take me through your last question quickly?
Yeah, basically what I was wanting to understand is what precautions should one undertake during this period? Wanting to fall pregnant, but you're possibly infected. I think lots of people maybe do not know how to navigate through that journey.
Yeah. That is so important. And here's the first thing I want to clarify. If you are HIV positive, you can still have a very healthy pregnancy. Yes, there are precautions that we will take. So let's take just the client randomly walks into your rooms. We want to know, like I said, within the first trimester already, we want to test and see that you are positive. If you came in already knowing that you're positive, Or let's take it even a step back. You are positive, your partner is not, and you want to fall pregnant. There is something we call pre-exposure prophylaxis, which means it protects your partner. You are already on treatment, which means your viral load is low to undetectable. In fact, we always want it to be undetectable. You find that when we do that, you are unlikely to transmit the virus to your partner. That means you can share your child together in the most natural way. But also, secondly, once you are pregnant, continue to take your medication. We encourage patients, it may be daunting, continue taking that medication. Even for the child, as soon as the child is born, there is sort of like post-exposure prophylaxis, which means we understand the mother is exposed. So, we understand the mother is positive. That means the baby has the potential to be exposed. There is prophylaxis that we give to the baby immediately after delivery, and we will then check the baby as well. And then when we talk about post-exposure prophylaxis, sometimes oopsies happen. Sometimes you get into a situationship and you're like, I could have, I should have, but you didn't. There is still an opportunity to get what you call post-exposure prophylaxis. These are antiretrovirals that are short-term based, but they are designed to help or to assist that you don't get that transmission from a partner, which you either have no idea what their status is, or you may actually even be aware what their status is. So this is such empowering information, because sometimes we think it all depends on what my partner discloses or not discloses. I always say, first and foremost, take your sexual health in your own hands, protect yourself, and make sure that you're protecting the people that you love around you.
Yeah, there's nothing as daunting as the fear of the unknown. So by all means, get yourself empowered and be on top of things. Thank you. Thank you, Dr. Zenda. Now, before we wrap up our conversation, besides using condoms, what other safe sex practices do you recommend for individuals or for couples?
It's so funny.
Yeah, you kind of alluded to some of it, but I think that this is real life. People are living in a very different time.
And the reason I'm laughing is because, when we think about condoms, I don't think people actually realize how many of us struggle to use condoms the way they are meant to be, which is 100 times out of 100 times. The minute it is 99 out of 9, that window of opportunity, you've already opened for a possibility of falling pregnant or of catching something from somebody that you didn't want to. So other methods become important. I think Dr. Khan touched on it even earlier on. There are practices like try and prevent having multiple partners at any given time. So as much as possible. And I say this also very cautiously, because we live in a very diverse society where people have the right to choose how they practice their sexuality and their sexual behaviors. But still, try and limit it to one partner at a time. Try and also do, like I spoke about it, pre-testing before you engage. As much as possible, to the best of your ability, use that condom 100 out of 100 times. And if in doubt, especially during times where you either have had a sexually transmitted infection or symptoms, do not wait. Go and get tested and make sure that you get treated as soon as possible. Leaving things, even something as simple as a bacterial vaginosis or yeast infection. It's not a sexually transmitted infection, but because, especially for women, it changes the lining, which means if there are other more serious infections like herpes, HPV, as well as HIV, they are easily transmitted when we have those. So try and make sure that your ecosystem is always as healthy as possible. And I think probably the last one, and this one we struggle with a lot, is conversations. We need, you said it well, normalize conversations with our partners, with our friends, in terms of how, testing, in terms of asking about, so what's your sexual past, dude? Or my girl, where have you been? Right? And not be judgy, but rather use it as a way of saying, I want us to be safe. I want to protect you, and I also want to make sure I protect myself. So the more of those conversations we have is really great. And then I think last but not least, if you've already contracted something, please have the courtesy, the kindness, and just the integrity to let your partner know. Stay away from sexual intimacy, at least until it is treated and you've confirmed that you have been treated. But remember, your partner may not have symptoms and having had contracted the infection. I think things that I've seen, the worst things, is where one partner is aware, for example, they're HIV positive, but the other partner has absolutely no clue. That is unethical, that is unkind, and we are each other's keeper. So I really would encourage people, the less judgy we are, the more we open the conversation, the easier it is even to disclose those things that we may have been through and come with into perhaps a new relationship.
Yeah, there's nothing as powerful as knowledge and information, and then of course the safety of being able to exchange with each other. So thank you for that. So I think without further ado, let's get straight into the viewers' questions. I'm going to quickly see what we've got going here. Okay, shall we start with you, Dr. Khan? How
Yeah,
often
sure.
should individuals get tested for HIV, and are there specific signs that indicate a need for testing?
Yeah, I think firstly, obviously, all patients that are involved in risk-taking behavior need to get tested often.
Yeah.
And I mean, I don't have a set time for my patients to test, but I encourage it 6 monthly at my rooms so that patients know their status and their partners also, and they're communicating and they disclose each other. I mean, we are faced at times with situations where one partner comes in and is positive and they don't disclose it to their other partner and stuff like that. So I would encourage at least twice a year get tested, or at the very least once a year. If you are involved in risk-taking behavior, then maybe more often. So that obviously if there is a situation where you're positive, then there's early detection, there's early intervention, and obviously we can prevent any complications that arise from it as well.
Okay. I'm going to move over to Dr. Gaini. How certain can STDs affect men's, or maybe, I'm sure both of you can answer this question, but if Dr. Khan feels that he could answer better, how can certain STDs affect men's reproductive health?
I'll let Dr. Khan go. I'll answer for them.
So just repeat that for me, please. Yeah.
So we want to know, how can certain STDs affect men's reproductive health?
I think in general practice, and we see patients obviously with sexually transmitted infections, they present to us very late, especially the men. They're at a very advanced stage of disease. They've probably already infected their partner, and we then trying to obviously manage the infection itself and obviously the complications that arise from it. And obviously that can affect your sexual reproduction and things going forward. So what we just want to do is encourage patients to present early, and obviously so that we can initiate treatment early so that we prevent any complications that arise from the disease. Because obviously, like Dr. Zenda mentioned earlier, I mean, the bacterial causes like the syphilis, the gonorrhea, we put patients on antibiotics and we treat them and we send them home and we give them a bit of symptomatic treatment. But when it comes to the incurable viral infections like your HIV, your HPV, and those are the kind of viruses that can even lead to complications like cancer, So that is when the more complicated treatment comes in, and there are many preventable measures, obviously, before that with the viral ones like vaccines and things. So it's all very case dependent on how the patient presents to us.
Absolutely. Yeah. Thank you for that. Dr. Zenda, do you want to add anything?
Yes. So sorry. I think it becomes so important. One of the questions I get a lot, for example, is, well, if something like HPV, human papillomavirus, is a virus that can be transmitted between partners, male, female, but the reality is the burden of disease sits predominantly with the women. That is why, like I was saying, women would ask me, so why is he not having a pap smear? And I'm like, that's because he doesn't have a cervix. And the chances are, so when you look at the high risk HPV strains, for example, they are the cause of at least 70% of the cervical cancer. And even when you look at other types of cancers that you can get from something like HPV, whether it's penile, oral, or as in oropharyngeal, so your mouth, the percentages are really, really low. So that's also the other reason where, it almost sometimes feel like it's unfair that it's the woman who has to go and do a pap smear, and yet we were kind of together in this dance. Please take care of your health, go and get that done. Same with, chlamydia and gonorrhea, which are bacterial. They have a tendency, if not treated, to cause what we call PID, pelvic inflammatory disease. Maybe the man might not have such a big, a sequel in terms of what happens later. But in South Africa, for example, 40% of our infertility is as a result of tubal infection at an earlier stage, So the repercussions are sometimes grand for us as women. And so I'm not saying guys should not take responsibility. In fact, the more men take responsibility, the better it is. It is a couple thing, not an individual thing. But it's just important to note that sometimes the burden of disease falls on the one gender and not so much on the other.
Absolutely. And it's actually a perfect segue to my next question. How long after STD treatment should I wait before engaging in sexual activity?
Right. This one is a little bit tricky in the sense that it depends on a number of things. Patients or clients, for example, may be symptomatic. So if you go to your doctor, because of the symptoms, you start treatment. At the very least, complete the treatment. Make sure that what we call partner contact has happened, which means you've informed your partner and you have been treated for it. Very often, particularly when you look at public sector, we may not necessarily go as far as doing all the tests that we spoke about earlier on, which means you have to wait at least for the completion of the treatment, as well as the sort of like the disappearing of the complete treatment, disappearing of the symptoms. Tricky part is something like HPV virus. Again, I think HPV has got a bit of a thing because it's just like, I call it the flu of STIs, so to speak. The problem with it is that you may not be symptomatic and you will still contract it. And it can last in the system longer than 20 years.
Wow.
So then you say, so do you stop having sexual intimacy for 20 years? Absolutely not. It is important in those kind of scenarios, disclose to your partner. This is also probably similar to things like HIV. Disclose to your partner. Let them know what steps have you taken to protect yourself, but also to protect them. So be it treatment, if you need to be on long-term treatment, like in HIV, for example. If it's an HPV, if you've picked up an HPV, did you take the vaccine? Are you having regular pap smears to make sure that you haven't contracted more strains? But also the progression in the cervix itself hasn't progressed. So there's a number of things. I would say, sort of like as a general rule, if you have had testing done that confirmed that let's say you've got a positive herpes, at the very least, wait until, we often say at least another 2 to 4 weeks or so, because sometimes you may treat now, and if you test too soon, it still comes back as positive. So at least up to 6 weeks, go back, test again, and when the virus or that infection has subsided, then you may commence. But even when you commence your sexual activity, I hope this becomes then the sort of like not a scare, but sort of like just awaken you up to the importance of using barrier method protection all the time.
Absolutely. And with that question, or with that answer, allow me to quickly ask you, Dr. Khan. I am HIV positive, is this question. And the question goes, please share advice and tips on safe sex practices for me.
Yeah, I think the most important thing if you are HIV positive is firstly, know what your CD4 count is, know what your viral load is. If you have a high viral load, you're going to be infectious, and obviously you need to protect your partner. And like we say, we always underestimate the use of condoms. I think most people don't know how to use it properly, and there's a lot of stigma attached to it. And yeah, I'll speak from a guy's perspective. There are a lot of guys that just don't want to use a condom when they are intimate with a female because maybe the sensation is less, and these are the kind of complaints we face with in practice. So use it correctly, use it consistently, and it will provide protection from HIV transmission.
Absolutely. Dr. Zenda, what is the process for STI testing, and are there specific tests for different types of infections?
Yes, absolutely, yes. So there's probably two sides in terms of why people would come in to test. People may come in to test because they've had an incident that they may feel either they don't know what their partner's status is, and so they're feeling like they could be at risk. The other time is, like I said earlier on, just making it a practice to go and do your screening. So there's something I generally call the big five. This is hepatitis, herpes, HPV, HIV, as well as the gonorrhea and chlamydia. So, and then you've got the HPV, and the HPV generally goes hand in hand with your pap smear, because during your pap smear, whilst we look for the changes in your cells, we can also test for the HPV virus. So I often encourage clients to, regardless of whether you're coming in because something has happened or just because it's a regular checkup, go and do those annually at the very least, particularly, even shorter spaces, 6 months, if you've changed partners, if you may have been pre-exposed to a situation that is high risk. We spoke about rapid tests. We spoke about, and the rapid tests are either at home or in the doctor's room, but very often by the time you get to the doctor's room, we want to do more definitive tests. So it could be a urinary, it could be a swab that we send to the laboratory, it could be a blood test that looks for the specific virus or infection.
The next question I want to quickly ask: what are the most effective forms of contraception, and how can I choose the right one for my busy lifestyle?
Yeah. Contraception is a very personal, when it comes to efficacy, and maybe the conversation is, sometimes the most effective may not be the most suitable for you. So for example, when we're thinking about right at the top of the food chain, we've got bilateral tubal ligation for women, as well as vasectomy for men. The sort of like the con with those two is that they are irreversible. So they are the most effective, but they're not suitable for everybody, especially those who are still in their reproductive phase and wanting to have more children. Then the next after that is what we call the long reversible contraceptive. These are the ones that I call them sometimes the fit and forget. So things like your intrauterine devices, but also you get what we call implants that go just subcutaneously or just under your skin, and they are hormonally sort of like bound. So they have what we call a slow release hormone that is the ingredient that basically prevents the pregnancy. Things like injectables, which is either your 3 months or the 2 monthly injectables. All those fall under the long acting, and in terms of efficacy, we've got when it comes to tubal ligation as well as intrauterine devices and implants, you've got like a 1 in 100 women per year that will fall pregnant on that. But as soon as you start going to things like the pill, the patch, and the ring, that starts to increase. So for example, injectables sit at about 6 women per 100. Pill patch, 9 women. When it comes to a condom, it's 15 per 100. So you can start seeing what is most effective, but also, like I said, it doesn't necessarily mean that is the most suitable. For some reason, a lot of clients that I see, and a lot of people have this grand faith in what we call the interruptus coitus, which is interrupting coitus, or sort of like in the slang, what we call pull out. Unfortunately, 25% or 25 out of 100 women are likely to fall pregnant. It's one of the least effective method, and yet it's one that is very readily used. So there is more to contraceptive than just, what is most effective. It has to suit your lifestyle. Some people are for hormonal, some people are not. Find your suitable healthcare professional, discuss, have a conversation, and so that you can choose a contraceptive that is suitable for you and your lifestyle.
I must tell you, I'm so thrilled that we are having this conversation. It feels so enriching. It feels so safe, and it's pretty magical. And I'm glad and I'm happy that we're getting such great engagement from our viewers, and that we have two amazing panelists that is making it such a comfortable process. So thank you. I commend you guys, and keep up the great work. This is really a wonderful.
The two common questions we get in general practice when a lady comes in about contraception is what contraception, and it's so individualized. And what do you think the second one is? How much weight am I going to put on?
Exactly.
That is the biggest question. They are not worried about, listen, what is the type of contraception I need to take? What are the pros and cons? Everybody just wants to know how much of weight am I going to put on with the contraceptive that you're giving me.
You can just 100%. Imagine. So it's quite tumultuous, having to navigate through all of this. But it's good to know that there are options and that there are great varieties out there for us. So it's not just about the weight or the acne breakout or the hair falling out or whatever. This, as I say, I am so thrilled about this conversation, and I applaud you guys. Well done. I think there's always been this gap between science and laymen or normal people. And
yes.
It's a beautiful thing when we start bridging that gap, so we can just start making a healthier, happier, safer society.
Yeah, definitely.
So I want to say massive thank you to you guys, Dr. Zenda, Dr. Khan, for navigating us through this sexual wellness conversation. You've shared some truly insightful knowledge with our viewers today, with me. Oh my goodness, I just want to go and have conversations now. So thank you guys. Do you have any final advice or thoughts, Dr. Zenda? Shall I start with you?
Yeah, I think for the longest time, we all have felt a little uncomfortable when it comes to sexual health and reproduction, having these kind of conversations. I think we can no longer kind of sit like that. There is a responsibility between the client and the clinician. I know one of the things that I've often and always advocated for, particularly as a clinician, we need to raise awareness. We need to continue raising awareness. We need to create safe spaces for our clients so that they don't feel shy and awkward when they need to come and talk to us about these things. And then the responsibility on the other side, like I said, safety is absolutely sexy. Make sure that you have created a safe space for yourself, but also you are looking after everybody that's around you, particularly either the person that you are having sexual intimacy with, or if you are a woman and are trying to fall pregnant or are pregnant, protecting your unborn child from any unnecessary infections that they may get.
Absolutely. Dr. Khan, before you add your final words, I just want to ask you something that I've always also wanted to know. Are there male contraceptives? Because I feel like we're doing this together, like you participate in the fertilization as a man. So I just wanted to know, as a responsible participant in the deed, what male contraceptions are there out there?
Like Dr. Zenda touched on firstly, the vasectomy. Obviously, with vasectomy, I only recommend it to my older patients whose families are complete, because it's an irreversible process. Obviously, encouraging safe practices using condoms. And other than that, I don't encourage coitus interruptus too much, because there's always a risk with it. It's a complete no-no for me taking a chance. And I don't know if it's just a male thing. I mean, in general practices, if I had to look at patients coming into me, a lot of men would walk in that present with an STI and have multiple partners and are not honest with their partners and stuff, as opposed to females. And I'm just completely speaking from experience, seeing patients over the past 15 years. I don't think it's a common thing for me to have seen a female that came into my rooms, and said, listen, I have multiple partners and I have an STI, So it's a bit more tricky with the men. And so I don't know what advice to give them, but yeah, practice safe sex, have one partner and not multiple partners. Yeah, and we live in this world now with so much of technology also, and people may be shy to come into your general practitioner and touch base and speak about this, but you can get onto your phone today or you can get onto your laptop today, and there's so many search engines where you can actually just educate yourself about all of these things. You can educate yourself about what are safe sex practices, what are the different types of STIs, what types of contraception there's out there, and what are the screening processes, so then I can maybe feel a bit more comfortable and present to my healthcare professional and get those tests done. So even before stepping into a doctor's rooms, educate yourself. There's a lot of information out there, and then you may just feel a bit more comfortable.
Thank you.
Yeah.
Absolutely. Thank you. Thank you for this. Again, I'm going to reiterate powerful stuff, enriching stuff, and we really appreciate what you were able to share with us today. Remember, the journey to sexual health is ongoing. Clicks is with you every step of the way. And we, of course, hope that the knowledge that you have gained from our amazing panelists over here, was able to empower you to make informed decisions. Let's continue this discussion. Let's destigmatize conversations around sexual health. And let's, of course, contribute to building a healthier and more supportive community. Me, on behalf of me in South Africa, we want to say thank you to you guys, because it's role players like the two of you that are going to eventually, assist in making this a very comfortable place, an empowered place for us to navigate through our sexual journeys and our sexual health. So thank you very much, Dr. Zenda, Dr. Khan.
Thank you so much, Tarryn. By the way, you are absolutely fantastic. I think I said it the last time. You kept on saying, thank you, Dr. Zenda, thank you, Dr. Khan. And I'm sitting here, I'm thinking, you've carried this conversation. And
Thank you.
if there was a true sort of like collaboration between, the community and the clinicians, and how we can have this conversation anyway, in our homes, with our friends, it would go a long way in terms of us just living more safer lives.
Absolutely. Thank you so very much. Now, of course, follow Clicks and the hashtag Clicks Wellness Experts on the socials for more advice and the latest offerings. But of course, on behalf of Clicks, thank you to everyone that joined us today. And of course, stay healthy, stay safe. And until next time, good evening. Bye-bye.